Welcome to our 2025 Public Benefit Report launch. My name is Noam Liad. I'm the communications lead here at Nava, and I'm thrilled to be with you all today, here with you all today. Before we get into things, I just wanted to remind folks that the chat is open and that you can place questions into the Q&A box throughout the event. We'll be taking questions at the end following our panel. So with that, I will pass things over to Shah for some remarks.
Thank you, Noam. And yeah, thank you, everyone. Welcome everyone to our 2025 Public Benefit Report launch event. I really appreciate you all taking time today. My name is Xia Huang. I am the COO here at Nava, as well as one of our co-founders. For those of you who may be unfamiliar with us, we were founded as a public benefit corporation a little over 10 years ago, with the goal of making government services simple and effective by solving technology problems at their core rather than just putting out fires. We believed then, and we still believe, that addressing the root causes of some of these modernization challenges helps government build long-term solutions that people can trust. Since then, we've partnered with government agencies across all levels of government. We've operated in high stakes and oftentimes no-fail scenarios or challenging moments of legislative change, and we've grown to over 600 staff across the country. Through it all, our objective to build durable solutions as quickly as possible hasn't changed. In fact, we've only become more determined to deliver critical benefits at scale to people in need. Across the agencies we've served, we've supported enrollment in over 50 million households to access critical benefits. We've been able to save decades of call center or caseworker manual labor and helped agencies disperse billions of dollars in funds to families and households in need. Today, I continue to be inspired by our team's commitment to addressing these root causes and the determination to build trusted and durable solutions, one of the main themes of this year's Public Benefit Report. This is an urgent moment, and I couldn't be more proud of the work and outcomes that we're sharing in this year's report. You'll hear more about it today, but building long-term solutions has meant knowing when to tune our approach. Sometimes that's starting small, iterating and scaling as we did with HHS modernizing grants.gov, where over 300 billion in public funding flows every year to states, nonprofits, and community groups. Other times that means being methodical upfront and pursuing outcomes that may not materialize for years, like prototyping an API with Montana's WIC program in 2023, and those efforts building into efforts now at a national level with Nava Labs and other groups researching how states can better collaborate in order to share technology and funding. Our growth has also come with retention rather than churn, which I'm deeply grateful for, and has meant deeper expertise across the firm. In 2019, we began our first work with Commonwealth of Massachusetts, supporting the implementation of their paid family and medical leave program. Now over 30 staff across the firm have over 5 years of experience delivering paid leave programs, and over 60 have more than 3 years. From this depth, we've been proud, incredibly proud to support now 3 of the 13 paid leave programs across 13 states nationwide. Our public benefit report is a part of our corporate responsibility as a public benefit corporation. One of my only regrets is that, every year we can't share all the work that we're doing across dozens of efforts across the country. We can't truly do justice to the hundreds of civil servants that we work with, many of whom with decades of experience, or the hundreds of caseworkers or call center representatives or beneficiaries that we've done research with across the firm. But we are now 10 years in, and it has been a critical year full of volatility, but also a chance to think radically about effectiveness. We see our responsibilities as Nava to be ruthlessly focused on speed and outcomes, and to see our role in the space not just delivering, but also as an advocate for building state capacity and ensuring vendor accountability. 10 years in, we're staying committed to our mission of building simple and effective government services. 10 years in, we are ready to meet this moment. So thank you so much for attending today. I'll pass things off to our editorial manager, Kira, who will talk more about the work featured in our 2025 Public Benefit Report. Thank you.
Hi, everybody. My name's Kira. I'm our editorial manager, and like Shaw said, I'm going to just give a brief glimpse into our report. Okay. So again, I'm Kira. My pronouns are she, her, and I've selected one story from each chapter to highlight, but rest assured that the entire report is extremely interesting, so I highly encourage you go read the whole thing. But I'm just giving you a little sneak peek. So the first chapter of our report is implementing high impact solutions quickly. And this chapter focuses on implementing the smallest possible change that can produce an outsized impact. When we work this way, we can deliver value quicker, iterate and scale, all while helping our government partners de-risk, save time and resources, and gather user feedback. Oops. This has been our approach as we help the U.S. Department of Health and Human Services modernize grants.gov. Grants.gov is a federal service that connects grant seekers with more than $300 billion in public funding every year. In modernizing the service, HHS is aiming to make it the simplest, most effective, and easiest way to find and apply for financial assistance. Nava is helping HHS build simplergrants.gov, an open-sourced, modernized digital service that will replace all of the functionalities that grant seekers use on grants.gov in a phased, user-tested transition. In Nava fashion, we're tackling this work iteratively. That means we're focusing on specific experiences, for example, the grant search experience, and helping HHS build MVPs, testing those MVPs, and gathering feedback from users, and then iterating. This methodology is allowing HHS to deliver more value to users quicker. Something else that's interesting about this project is that all of the software we're helping HHS build is open source, meaning anyone can access the code or leave suggestions on how to improve simplergrants.gov. Building open source software makes the grant.gov modernization process highly transparent. It helps avoid vendor lock-in, and it promotes easy collaboration between government agencies and vendors. Something else that's critical to collaboration is interoperability, supported by application programming interfaces, or API-first infrastructure. This is what the report's second chapter focuses on. This chapter contains stories that highlight the value of effective data sharing and collaboration between agencies and other stakeholders. API-first infrastructure also helps drive down system costs and promotes positive outcomes for the public. An example of the power of interoperability involves electronic health records. It's crucial for electronic health records to be readily available and understandable by healthcare workers and other key stakeholders. However, healthcare entities such as hospitals or clinic might store electronic health records in different data formats, which can pose problems for interoperability, clinical decision-making, and cross-organizational collaboration. To help our partners advance healthcare data interoperability, Nava is building capabilities in the Fast Healthcare Interoperability Resources Standard, also called FHIR. FHIR is a standard developed by Health Level 7 International, or HL7, for exchanging healthcare data. It offers a format for data sharing, and it's flexible enough to serve many use cases. This year, we worked with several partners to build, maintain, and enhance FHIR-enabled products. For example, we partnered with the Centers for Medicare and Medicaid Services to design, develop, and operate their Blue Button 2.0 or BB 2.0 application programming interface and associated FHIR database. This is helping CMS work toward a state of interoperability between their own systems, providers, and third-party applications. Ultimately, this interoperability is empowering Medicare enrollees and their caretakers to make data-informed decisions. Another way to empower the public is through human-centered design, and that's what our third chapter focuses on. Prioritizing user needs isn't a nice to have. It's foundational to building efficient and effective systems that prevail for generations. By investing the time and resources to understand people's needs, government agencies save on both in the long term. Our Nava Labs team is seeing the benefits of human-centered methodology unfold in real time as they build an AI-powered assistive chatbot for caseworkers to use when helping families find and enroll in public benefit programs. The team began by conducting extensive research with caseworkers and community partners, and that informed the project's direction and chatbot details, like using hand-picked source material and providing direct source quotations in chatbot responses. If the chatbot makes an error, caseworkers can give feedback, enabling our team to quickly address the problem and avoid similar issues in the future. All of this helps build trust with caseworkers while ensuring the product meets their needs. And then the final chapter of our report focuses on pursuing durable outcomes. At Nava, we emphasize the importance of building internal government capacity and future-proof technology so that our partners have continued success long after the contract ends. Our commitment to promoting long-term success is one reason many of our government partners decide to work with us again and again. Our work in paid family and medical leave, or PFML, is a good example of this. 6 years ago, we won our first prime contract working on paid family and medical leave services when the Commonwealth of Massachusetts tapped us to help build and maintain their brand new PFML program. We're still working with Mass today. In 2024, we won prime positions helping 2 other states build their PFML programs, making us a prime contractor on 3 of the 14 PFML implementations nationwide. We were able to become one of the premier PFML vendors in part because we've cultivated a very strong talent pool of PFML delivery experts. These team members can hit the ground running, enabling our new PFML partners to fire on all cylinders faster. Our staff have also honed and iterated on best practices that loosely apply across PFML programs, all while keeping up with cutting-edge technology in our industry. We've also built modular tools and templates that help our government partners accelerate prototyping and deliver tangible, positive outcomes for feedback in weeks, not months. And finally, working across states means we can reuse proven best practices. This is more cost-effective for taxpayers and state agencies. It helps applicants receive benefits as quickly as possible, and it reduces burden for state agency staff. So as you've heard, Nava is deeply committed to building long-term momentum for effective government services. This year, we helped HHS iteratively build out simplergrants.gov. We invested in our FHIR capabilities to promote interoperability in healthcare. Nava Labs built a human-centered AI chatbot, and we began to shape PFML delivery in the US as a premier PFML vendor. The roots we laid over 10 years ago at our founding are still growing as we expand impact to new partnerships and programs. This is what it means to build long-term momentum for effective government services. And with that, I will pass the mic to Noam, who's going to kick off our panel. Thank you.
Great. Thanks, Kira. Moving into our panel now, I'm happy to be introducing our moderator and incredible guest panelists today who will be discussing how human-centered methodologies can lead to durable outcomes as agencies start to implement AI. Moderating the event is our very own Martel Esposito. Martel is the Director of Partnerships and Advocacy at Nava. She leads Nava's partnerships with nonprofits, think tanks, and academic institutions. She also co-leads Nava Labs, Nava's philanthropically funded research and development arm focused on prototyping products, practice, and policy ideas that catalyze systems change, and then advocate for the adoptions of those that show promise. Prior to Nava, Martel held roles in the nonprofit and academia space, managing programs, grants, and government affairs. Through this work, she's helped improve community food environments and access to health services, created better experiences with healthcare, studied interventions that improved participation in government programs, and lobbied Congress for health and nutrition priorities. Happy to have Martel as our moderator. Moving to our panelists, our guest panelists today, we have both Jillian Gutierrez and Jessica Manili. Jill is the director of New Jersey's Office of Unemployment Insurance Modernization. She oversees the effort to build a flexible and claimant experience-focused UI system for the state of New Jersey. Jill works closely with her colleagues across the state and in federal government to transform the unemployment benefit experience by delivering iterative solutions using agile methods and human-centered design. Previously, Jill was the Director of Strategic Planning and Outreach for the New Jersey Department of Labor, where she led efforts to increase access to workers' benefits and protections, including paid family and medical leave and earned sick leave. She also served over a decade at the U.S. Department of Labor, where she was a strategic planner for the Women's Bureau. We're thrilled to have Jill here today. Okay, moving to our second panelist, Jessica Manili. Jess serves as the Assistant Director for Process Innovation at the American Public Human Services Association. In this role, she leads a team dedicated to developing and testing customer-centric innovations in partnership with people who have lived experiences accessing government programs. Jess and her team host cross-disciplinary member spaces, including the ISM Affinity Group, as well as the Process Innovation Community of Practice and AI Work Group. Before joining APHSA in 2021, she led technical assistance projects with state agencies, managed process improvement and evaluation efforts, and produced publications on public benefit policy and systems issues. Jess has also worked directly with human services customers to help them access programs and services. Thank you both again for being here today. And with that, I will pass things over to our panel moderator, Martel.
Thank you so much, Noam, and thank you to our panelists. Welcome. We're so glad you're here, and we're excited for you to share your insights today about leveraging AI to build long-term momentum for effective government services. So let's start with the topic of trust. It's a central topic in AI work. We know people can be skeptical of AI, and others can also be overly trusting. So when introducing AI to public benefit programs, building trust is critical. So to both of you, in your experience, how do you build trust with people during modernization efforts, especially ones that use AI? Maybe starting with Jill.
Thanks, Martel. Thank you all for having me. I'm going to start with an example that talks about translation in AI. And I think that many of you will find that governments are often skeptical of offering translations. It's a place where it's very hard to manage the risk of the language and the risk of the words. Bad translations could end up with bad customer experience. It could end up with more work for the agents, the state staff that work on those claims. And it could show that you don't take seriously your responsibilities as a government agency if you're offering a poor translation. Regardless, when we worked with multiple partners, including Nava, the U.S. Department of Labor, to create our new unemployment insurance translation, we put a stake in the ground and said this one is going to be launched in both English and Spanish at the same time. But this application is a critical form. It's always changing. Policy is changing. Process is changing. We're adding new features. So the risk there, and the thing that you have to build, is your ability to keep it in parity. How are you going to keep that translation in parity? And so working with USDR and working with Nava to launch this application, we created an AI translation toolkit that both starts with the plain language verbiage of what do those formal terms mean? What does all that language around UI mean in plain language English? Turning that into plain language Spanish by working both with our call center agents who speak Spanish to claimants every day and know the work that goes into how would I explain the difference between being fired and being laid off in Spanish, as well as testing that. So using the human-centered process with folks on the ground who speak Spanish from many different countries to make sure that we were offering something that was both truthful and meaningful and would help them answer those questions in the way that they intended to. So this process of using AI translations puts humans at the front. It builds in their knowledge and their capacity. And it also puts humans in at the end where it says, let's review that and make sure that the translation we're getting out of this prompt we built with USDR and this glossary we built with our state staff and our claimants is really giving us what we want. And even with that humans in the front and the humans at the end, it's still over 2/3 faster. And it has a lot of trust because of the human knowledge that's poured into it.
Amazing. Thank you. Thank you, Jill, for that detailed example. And I know, Jess, you have some examples and thoughts to share, particularly in the context of your work with SNAP modernization. And we'd love to hear a little bit more about that.
Yeah, hopefully it worked that I just dropped a link in the chat. We'll see if that works. But in terms of trust for AI, I think one of the projects that I wanted to talk about is what this paper is all about, which is our AI-powered SNAP modernization research project. And Jillian has a lot of through lines with what you were talking about around person in the front and at the end. So we talked for this project first to state agencies, but this latest brief is around what customers and end users, so people who are currently receiving SNAP, expected and want to see out of AI implementation for SNAP case processing. And so we did 3 focus groups. It was 13 customers, and there's a lot you could read about it, but it kind of boiled down to 2 things. So we the 2 major themes that the customer insights boiled down to were human oversight and expertise. So a human in the front and a human at the end is exactly the kind of thing that a customer would say, okay, that is like a positive flag in the trust direction. And then customer centricity and transparency. And so by that, which I can talk a little bit about customer centricity a little bit later too, but with that, they really mean that the systems enhance clarity, they enhance accessibility and usability from the end user standpoint, and everywhere in between the user spectrum for that matter. They increase the visibility of decisions and data use and service process use. So people were really skeptical when it came to more opaque systems or creating like black box processes, and more kind of supportive of using AI for more explainable, plain language versions of information, rights, responsibilities, that kind of thing. And other advice that we've gotten both from customers and from folks who administer SNAP, just because that's where we did our first AI research, was to listen to real users and their comfort level with automation. That's both on the customer side and the staff side, and bake that into your AI implementation roadmap, because that will help gain public trust, user trust along the way if you're like meeting people where they're at. And make sure that as you're implementing, you have trustworthy experts who are doing the implementation of your AI, and that they like have deep knowledge of the systems that you're already operating within. That was another thing that administrators especially raised, was like, we need people to have full appreciation of the systems and the technicalities that we're operating within right now, and not just come in with this like new AI solution to layer on top of something that they're not going to know what the domino effects are. And I think I'll kind of wrap it up there.
Wonderful. Thank you so much, Jess. So in summary, it sounds like in many ways, building trust with AI tools is similar to how we would go about building any technology and building trust in any technology, listening to people who are using the technology, engaging the people who are the experts and the folks with lived experience, building something that meets actual needs, understanding and addressing concerns. I heard that through both of your examples. It's also sounding like now more than ever, there's an increased importance on centering outcomes. I heard you both talk about like with the impact that this work is having. So centering outcomes to reduce the pain points and build the trust, not just product outputs to check these product boxes or contractual boxes. Which brings me to my next question about AI supporting people in their work and not just replacing them. You kind of got at this a little bit with this idea of people at the front, people at the back, and both of you have been vocal about this over time. But what are some ways you've seen teams work effectively alongside AI tools?
I'll start. One of the other tools we were building, and again, this one started with US Digital Response, and we're now working on Nava with it, is to think about how our unemployment adjudicators, so people who make decisions about claims or claims issues, how could they write better decisions? So how could we help the claimant understand why the issue is being decided in a certain way, how the facts of the case led to a certain decision, so that we're increasing the trust back and forth between the state agency and the claimant who's receiving the communication. And so by bringing together those team leads, those leads of adjudicators across different adjudication centers, so different places making decisions, different teams, and having them analyze together, what does good look like? What does a good decision look like? What are the models that we all agree on or are going to fight about and get to an agreement about what we should be striving for? What do the lawyers say are the hierarchies of the regulatory process, right? How does the federal regulations stand up against the state administrative code, stand up against the Supreme Court cases, for example? How do we measure those things? And when we put those teams and that work together, we can help feed into an LLM what the human decided. So what did the human decide was the facts of the case? What did the human decide is the final outcome? And how can we use the what good looks like and what the order of importance of the legal code to put together in plain language something that communicates to the claimant, this is the decision that was made by the human. This is the legal writing of the thing. This is the explanation. This is how you can understand how that fact led to this decision, so that when a human receives it, they can understand it. Now, we won't allow for the LLM to just spit out the decision, spit out the legal writing, and there it is, right? The process, again, has to have a human at the end, where the human reviews, did it match the court cases to the state, to the fact? Did it match? Does the communication flow? Where in there do I need to edit or repurpose things so that the claimant can understand? But it's taking the rote work out and leaving more time for the human work and the quality of the work. So in this case, we're really like strengthening the staff, like coalescing around what good looks like. So in the end, what the claimant receives is more clear, more transparent, and it causes less rework. The claimant is less likely to need to like call in and ask a question, what did this mean? Or file an unnecessary higher level appeal, because we've worked as a team to coalesce around what good should look like.
So it sounds like the LLM work or tool, or however you're integrating the LLM, is helping to elevate that output for the claimant that the human is putting together for them, so that it's ultimately helping the whole process. It seems like it's helping the adjudicator with their work, but it's also helping the claimant get clearer, more transparent understanding of their decision. So that's really cool. I love that example of kind of the interaction between where the AI shines and where the human shines. And I know, Jess, you also have some great examples from your work across human services programs as well.
Yeah, I feel like a common theme is pulling out that human, like where the human shines versus where the automation enhances that. And I'm trying to think, so in a parallel in like SNAP and benefits kind of sphere of the world, like taking elements of a caseworker's time or their day and simplifying that, and therefore freeing up their time to spend more meaningfully interacting with customers and folks who are navigating these systems. Definitely is like the end goal. I think we're still kind of getting there in terms of pilots, and like proof points. So uh, things that summarize case notes, for example, or make case files more skimmable, or are like call center and caseworker work aids, we'll call them. So again, kind of like in service of better customer experience and service delivery, but more of a tool for that. Um, we've also seen agencies create like policy bots, which is kind of like a chat bot with your policy manual, or that's been fed a bunch of different policy documents and FAQ type things for internal agency operations. So more of that like staff aid, making sure that people have like really just streamlined ways of operating and doing their jobs using the best technology that they have available so that they can face and provide better customer experience. Um, and I did want to drop in the chat, which I don't think I did yet, but our membership put together what's called like our posture for human services agencies towards AI, and it just reflects kind of a lot of these best practices for implementation around, um, what kind of stewardship you need around data and privacy, for example, in order for the implementation to feel trustworthy for your customers, for your staff, and so on.
Great. Thank you, Jess. And thanks for that resource. And all of this is reminding me about how in Nava Labs, we talk about this interaction between AI and where AI is a fit and where humans are best fit as the choreography between the AI and the human, and how getting that right, getting that choreography, getting that dance right has the power to improve experiences for staff and program participants. And I think you both have sort of shared some insight into that today. And I would now like to pivot slightly to a different topic, but still important, and something that also, Jill, you sort of alluded to with the adjudication process, how there's so much, there's policy and case law and all these other things. But there's also policy and federal oversight in the context of actual implementation of the tools themselves. So a policy and federal oversight has the power to facilitate or hinder responsible implementation of AI tools in state administered programs. So I'm curious, what are you doing now within current policy constraints? And is there anything you'd like to change about the current policy or oversight landscape that would enable responsible implementation of AI? Yeah.
I can kick off with what we've like had in conversation with our members and state and county agencies who are exploring AI implementation. We've been having a lot of active conversations with members around AI take up, both what's enabling take up and what's kind of getting in the way. And honestly, regulation and rules aren't the biggest barrier to adoption right now, the way that I think is kind of predominantly assumed in the narrative. I think what we're more so hearing is we're just in more of a pre-regulatory context. There's not a lot of regs, there's not a lot of guidance to inform take up right now in a way that actually agencies kind of want and need, at least just in terms of that level of assurance that when they do adopt this new technology or turn on these AI features, it won't be uncompliant later. So I hope that kind of made sense, but the blocker isn't necessarily a bunch of different regulations that are in the way, and we need to overcome those regulations in order to adopt AI effectively. But more so, it's like the regulation is in the making or will be eventually someday. And so how do we make sure that the things that are being tested right now, the things that we're learning right now, inform that policy development, and are supported by guardrails, by the architecture and risk management frameworks that we like have been building and have access to, even though we don't have like firm statutes and guidance around everything in terms of AI implementation. Now, I will say that our membership, our membership includes health and human services agencies, administrators, kind of for a lot of different human services and ecosystem kind of partner programs, but in particular in the SNAP world, there's pretty unanimous thoughts among our membership around merit staffing rules, and there being some regulatory barrier around how AI can assist cases and SNAP customers through their case process due to some of the restrictions around merit staffing rules. So that's one area where regulation kind of is a barrier. And then otherwise, I think what we're more so seeing is people needing some guidance, some guardrails, resourcing, expertise, dedicated funds, those kinds of things to enable adoption.
Great. Thank you, Jess. And Jill, do you have any thoughts on this?
I think my thoughts are mostly that I'm grateful. I think that in New Jersey, we've been really fortunate. We've had, like with our State Office of Innovation and with our OIT, they've both built the training for all of the staff to take, for all state staff to take, as well as built the AI instance that is for state staff to experiment with and play with. So sort of a walled off area for state staff. And I feel like with our commissioner is actively encouraging everyone to take this training and to experiment. And we're near 100% of all of our Department of Labor staff have taken this training, which means that everyone from call center agents to wage and hour investigators are at least getting some exposure to, and then some ability to start playing with it and thinking about how it might be useful for things that they know best, right? That the challenges that they see best and where it might fit. And with the Office of Innovation with Nava, we're using this tool, this AI instance, to analyze our customer feedback and look at the trends and look at where our roadmap might need to be adjusted because of the feedback we get on our claimant status page or we get on our intake application. So that's been, really exciting. When you think about we can't change the thousands of pages that govern UI administration, but we can, and we're trying to find ways where the technology can give us more clarity and give us that place where we can increase the trust in the services we offer. So I'm very excited by what we have been given in New Jersey for resources, and I hope it continues.
Wonderful. Yes, thank you, Jill. And also, I know your colleague, Beth Novick, Chief AI Strategist for New Jersey, has amplified the need for upskilling while also emphasizing that policy is just there as a guardrail. She recently stated, related to your updated AI policy, I believe our next challenge is to accelerate how we use these tools critically in our day-to-day work to improve service delivery. The policy is a guardrail, but purpose is impact. So again, going back to focusing on impact and addressing needs and those kinds of things. But she also went on to share, by using AI to match records across agencies, the state's Office of Innovation enrolled more than 693,000 eligible children in the summer food program, reaching tens of thousands more families than traditional methods. So New Jersey is really a leader in AI implementation, and I'm curious, Jill, I know you've shared some impacts so far, but what are some of the most exciting early impacts or early learnings in the Department of Labor work that you've done? Yeah, just would love to hear some further thoughts on that.
Thanks. It is very exciting. I would say there's a few things, right? How can we feel more comfortable offering translations? How many other languages could we do this with, given the state staff that we have and the languages that we as the state staff have access to within our own ranks? I'm really excited to see how we could make there be less friction in the offering of a translation through these AI tools. I'm also interested to see, one of the challenges we have is oftentimes is modeling what are UI trust funds. So what the amount of funds are that we have through both seasonal things like the pandemic, right? What is that going to look like? And we've been working with Nava really to try to understand and model how could we better predict what those flows look like so that we can even out the experience both for claimants or workers who pay into our system, as well as for employers, right? How might AI make that path more even? And then finally, another thing I'm excited about, and many of you who work in government services probably can imagine, is we produce a lot of documentation. We are very good at writing lots of things down. But when you're a government worker and maybe you're a systems tester, or maybe you're a quality assurance person, or maybe you're a policy person looking for the decision, how can you sort through all of that information to find the actual source of truth, right? How can we use AI to make us feel more secure, that we understand what the latest and greatest is, what the decision record is, what the choice was, and how did we get there? And so these types of products and questions that we're thinking about with our partners at Nava, I don't know, I'm really excited about them.
Wonderful. Yeah, your energy is infectious. I'm getting excited just hearing you talk about them. And Jess, I turn it to you. What are some early AI wins or lessons learned that you're most excited for that have happened and will push us into the next phase?
Yeah, well, I think those are really exciting movements. I think a lot of the call center type applications that we've seen in the public benefits access space, I'm thinking of the New Mexico SNAP agency has used AI and bots in their call center contexts as case agent assistance, and has seen a lot of process improvement there. We're looking at outcomes like time spent on the phone going down, or less errors for SNAP applications, which is even more important than ever before right now. So other things that I think are exciting are also just on the total back end of things. So AI and automations that are more advanced, but maybe don't need to be AI all the way. But I'm thinking of some examples where it's taking information or data elements from one application and then feeding it into the other. There's been these Medicaid baby bot examples where if there's a new child that's born and added to a Medicaid, to the Medicaid system, that it's automatically also added to that household's SNAP benefit to be included in the benefit amount, and potentially even a factor in a household SNAP eligibility later on. So just one example of that back-end information feeding across systems that just this AI and advanced automation moment is making more feasible. So I mean, and then that ultimately trickles down to a young family having food much faster than they would have without having streamlined that process. So
Great. Thank you. Thank you both. So for our last question, and to kind of lead us all inspired. Where should we start? Where should others start? So what are some ways that state programs can begin to implement and scale responsible AI tools? Where do we begin?
I guess I would suggest for just the basic, like start with an example is USDR released all of our LLM training materials and our glossaries on their website. And it's really easy just to take our UI glossary, take Arizona Snap glossary and start playing with it and see what it comes up with for the things that you would want to say about your program. I think that experimentation is the key, right? We have agencies within our Department of Labor now who are building their own prompt related to workers' rights or related to paid family and medical leave and their own set of glossaries in Spanish and Haitian Creole. So I think the exposure to both the process of it and the ease of it once you've got the prompt and the glossaries allows people to start experimenting and see what might be able to happen in their own program.
Great. Jess, what thoughts do you have?
I think just blowing that very specific starting point out further is just don't reinvent the wheel. Like start with things that already exist, like that repository, plug into groups that exist. Like we have member groups like the Process Innovation Community of Practice that Marshall mentioned earlier, and our ISM Affinity group. Those are for government agencies, but I'm sure there are plenty of other like cross-sector, cross-sectional groups where peers in these agencies who are trying and testing these new automations out, who are shopping for the same AI features as you, are gathering and swapping intel and swapping lessons learned in real time. And so I think starting by plugging into those spaces is a great thing to do. I also think just the tried and true practices, like this is technology implementation after all, like this is modernization, which we've been doing. So like, let's rely on that human-centered design kind of ethos and like it being AI, and so the stakes being a little bit higher maybe just makes it that much more important that we do rely on our user-centered design type principles and those practices that we've already been building muscle in. So yeah, I think like use this as a starting point, like go back to those frameworks that we already know are kind of best practice. And then I think the one last thing that I do want to say is working this in with your customer advisory and any like community engagement type work that you're doing to kind of get the public pulse on what is expected of your agency by the people that you're delivering services to. So
Yeah.
yeah.
That's great. I'm hearing from both of you, like leveraging existing things, leveraging existing tools, leveraging existing work, and then going back to many of the themes of the discussion today around approaching this like we would approach our modernization efforts. But I like your point, Jess, of like it's now more than ever, it's really important to practice human-centered methodologies, to engage the community, to evaluate for impact, to measure the things that we're doing, to understand the impact that we're having. I also want to echo I want to share that Nava Labs also has several resources that are free and available. We have case studies of our AI prototyping and pilot projects, toolkits, open source code. We have an AI appropriateness checklist that walks through the steps of identifying appropriate use cases for AI and readiness for implementation. So those are just some of the things that we also have on the Nava side. And I'd also welcome people on the session today, on the webinar, to share in the chat of any other resources that you have found valuable or you've come across in thinking about or starting to implement AI responsibly. So thank you. That concludes our panel. And thank you to Jill and Jess. for this wonderful discussion. And now we'll open it up for a few minutes of Q&A before we wrap up. All right, it looks like we have a couple questions that have come in. One question or kind of a statement asking for some thoughts. In my work with California state agencies, I've noticed there remains a reluctance to fully trust generative AI for direct citizen services. However, agencies are generally open to leveraging it as a tool to assist internal teams, such as customer service representatives. I'm interested to know if this trend is also seen at the federal level and what strategic steps are being taken to address these trust barriers. So, do either of you have any insights about this particular question?
I don't have additional insights on this question. I am really curious to know more, though, about the insights that that question comes from,
Yes.
because it sounds like, yeah, so it sounds like someone in California has talked with the customers and end users on the other side of it, like maybe like a Snap or a benefits chatbot, and that there's like a trust delta there, and I'm curious what that's
Yeah.
all about.
Yeah. I think this is an interesting point. I think it's something that we have, as a field, and particularly at Nava Labs, have also focused to date primarily on staff-facing tools because there's lower risk in staff-facing tools where you have human oversight, you have a level of expertise. But we also have started talking about, are we ready to kind of think about these from the participant-facing context, from the beneficiary-facing context? So I don't have answers for you either, but I just wanted to highlight, like, it's something that we're also thinking about. So if you want to reach out and chat more about it, we would love to have that conversation. Next question is, how do we balance and normalize the cost of running AI features, security admin overhead, and model output refactoring requirements against process flows without the model? Are these factors we are enumerating? Is this something, Jill, that you have experienced in your implementation?
I think I need a translation first.
Okay. Let's see. How do we balance and normalize the cost of running AI features against process flows without the model? I'm actually not quite sure. That is a good question. If you wrote this question, can you make some clarifications on what what you were referring to here? And perhaps this isn't a good question for us and the folks on this panel. And maybe this is a better question for an engineering staff who might work on some of this work. Unless you also have some thoughts, Jess.
I am just glad. Yeah, no, I also
Great question. We just don't fully understand it. And there are probably lots of people out there who do, who could answer it, and or we could get some more clarification and kind of work on it. So for the last question, as you look to the future, say over the next 5 years, what are some AI opportunities that you're most excited about, either in your own program or the organization at large?
You want to go first, Jill, or you want me
Sure.
to?
I'll go. I think we talked a little bit about it already, right? There are things that we can develop that can be easily adjusted to so many other cases, right? Unemployment in New Jersey is not the only thing that gets adjudicated by state staff, right? That depends on state laws and federal laws, right? The models that we are developing can be easily replicated. The prompts change, the inputs change that the LLM reads, but there's so much power in the how could we edit this to make it work for my federal program, for my state benefit program. So that is something that I am excited about. The other part is like just really thinking about the human experience, is that when someone is desperate and they don't understand what's going on, they want to know like what's going on with my claim, what's going on with my benefit application. They want to talk to a human, right? And so if we can constantly think about how might I free up more humans? How might I free up more bilingual humans? How might I free up more people who could be that source of confidence and trust on the other end of the phone by freeing them from the rote activities or the processing activities that don't actually require human empathy or human knowledge in order to make point A move to point B. So, you don't really predict that we're going to get an increase in federal funding to increase our number of state staff, right? And so when you think about doing more with less, right, how can we increase the ability of our states to do human touch and decrease their need to do the things that humans don't perhaps need to do as much? So thinking about that balance and trying to figure out how we could make that a more realistic experience for the people who need to talk to us is something I'm excited about.
I love that. I love the thought of freeing up more humans for the more empathetic tasks. Jess, what are you most excited about for the next 5 years in this space?
I am excited to know what works and then double down on what works. I think we've been in kind of a go, 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 like pilot and see what's going to work moment. So what I'm excited about is hopefully some evidence building and some rigor around some research that's telling us what direction we should be moving in. I also think like at the same time, this technology is able to be scaled fast. So like Joe was saying, across benefit programs, as we're learning what works, adopting that for a different program or different use case within or across agencies. And then also to meet like the current policy moment, like we're working on right now around HR1 implementation, and hopefully getting the opportunity to work together too on scaling solutions for embedding policy compliance in technology, using that open source material and then testing it elsewhere. So I got a little bit in the weeds there, but
I love
I'm
it.
excited for like
Yeah.
the short term and the macro.
Yeah, I'm also really excited for the implementation research and kind of the next phase of the field, moving from these examples and these pilots into broader adoption and kind of understanding the processes and factors that like facilitate and hinder that adoption. So I'm right there with you. But with that, we are at time. And so I'm gonna thank you both again for spending time with us and having this discussion. And I'm going to pass it back to Noam to wrap us up.
Great. Thanks, Martel. That concludes our 2025 Public Benefit Report launch event. The link to our report is in the chat if you want to check it out or share it around. Thanks again one more time to our speakers and to everyone for joining us here today. And have a great rest of your day. Thanks all.